Welcome to Cluster Fudge, the podcast that dives into the topics we often shy away from but need to talk about. I'm your host, Alexandra, and today we're tackling a subject that's both urgent and uncomfortable: the rising problem of sexually transmitted infections and diseases, STIs and STDs. Despite decades of education, prevention tools, and medical advances, STI rates are increasing worldwide. So why is this happening? What do we really know about these infections, how they spread, and what we can do to protect ourselves? Stick around. This episode is for anyone who's sexually active, curious, or just wants the facts without the stigma. Let's break it all down. All right, let's kick things off with the basics. What exactly are STIs and STDs? You hear these terms a lot, sometimes used interchangeably, but there's a subtle difference worth knowing. First up, STI stands for sexually transmitted infection. This means an infection caused by bacteria, viruses, or parasites that is transmitted from one person to another through sexual contact. The key word here is infection. That means the pathogen has entered the body, but it might not have caused any symptoms yet. On the other hand, STD stands for sexually transmitted disease. This is when the infection progresses and causes symptoms or health problems. So in simple terms, all STDs start as STIs, but not all STIs become diseases. Let me give you an example. Someone might have chlamydia, which is an STI caused by bacteria, but they don't feel any symptoms. They're infected, but not diseased in the sense that there's no obvious illness or pain. But if left untreated, it can develop into an STD with complications like pelvic inflammatory disease or infertility. This distinction is important because many people don't realize they're infected, and that's a big part of why STIs continue to spread. You can have an infection, not feel sick, but still pass it on to your partner. Now, what are the common STIs and STDs out there? Some of the most well-known include chlamydia, one of the most common bacterial STIs, especially among young people. Often asymptomatic, but can cause serious reproductive issues if untreated. Gonorrhea, another bacterial infection that can infect the genitals, rectum, and throat. Resistance to antibiotics is becoming a real concern here. Syphilis, a bacterial infection known for its dangerous late-stage effects if untreated, including neurological and cardiac problems. Herpes simplex virus, HSV, a viral infection causing painful sores and blisters. It's lifelong and can be transmitted even when no sores are present. Human papillomavirus, HPV, the most common viral STI, with some strains causing genital warts and others linked to cervical and other cancers. The HPV vaccine is a game changer here. HIV, a viral infection that attacks the immune system, leading to AIDS if untreated, but modern treatment makes living with HIV manageable. What's crucial to understand is that many of these infections do not always show symptoms right away. In fact, it's estimated that more than half of all STIs worldwide are asymptomatic. People can carry and transmit infections unknowingly, which is why routine testing and honest conversations with sexual partners are essential. Sometimes people think, if I don't feel anything, I must be fine. That's a dangerous assumption because untreated STIs can lead to long-term health problems like infertility, chronic pain, certain cancers, and increased risk of HIV infection. Also, let's talk briefly about modes of transmission. While sexual intercourse, vaginal, anal, or oral, is the primary way STIs spread, some can also be passed from mother to child during childbirth or through blood contact in rare cases. It's important to be aware of this because it highlights how STIs aren't just taboo or dirty issues, but real medical concerns. So, what are the symptoms to look out for? Here's a quick rundown. Unusual discharge from the penis or vagina, burning or pain during urination, sores, bumps, or blisters around the genitals, anus, or mouth, itching or irritation, pain during sex or bleeding between periods, flu-like symptoms, fever, swollen glands in some viral infections. But again, sometimes there are no symptoms at all, which is why prevention and regular screening are your best defenses. Before we move on, one final note on terminology. Some people prefer the term sexually transmitted infections because it's less stigmatizing and more accurate for describing the condition before it becomes a disease. Understanding these basics lays the foundation for the rest of today's episode. Up next, we'll talk about the alarming rise in STI rates and why this is becoming a serious public health crisis. All right, now that we've laid down what STIs and STDs actually are, let's talk numbers. because the reality is we're dealing with a full-blown epidemic and the stats are alarming. Globally, the World Health Organization estimates that more than 1 million sexually transmitted infections are acquired every single day. That's right, every single day, over 1 million new infections. When you multiply that out, it's staggering. In the United States alone, the Centers for Disease Control and Prevention, or the CDC, reports that nearly 20 million new STI cases occur each year. That's about 1 in 5 people living with an STI at any given time. The rates of some infections like chlamydia, gonorrhea, and syphilis have been rising steadily over the past decade. In fact, according to the CDC's latest surveillance reports, gonorrhea cases increased by over 50% from 2015 to 2019, a sharp spike many experts attribute to antibiotic resistance, reduced condom use, and gaps in public health funding. What's more, young people aged 15 to 24 account for nearly half of all new STI cases, despite representing only a quarter of the sexually active population. This age group is particularly vulnerable due to a combination of factors like inconsistent condom use, multiple partners, and limited access to healthcare or sexual health education. There's also a troubling racial and socioeconomic disparity in STI rates. Data shows that Black and Hispanic communities in the US face disproportionately higher rates of infections compared to white populations. For example, Black Americans are diagnosed with gonorrhea and syphilis at rates several times higher than their white counterparts. These disparities highlight systemic issues like lack of access to healthcare, stigma, poverty, and education gaps that all contribute to these outcomes. And it's not just the US. The global picture shows vast inequalities as well. In sub-Saharan Africa, for example, rates of STIs, including HIV, are extremely high, driven by poverty, gender inequality, and limited healthcare infrastructure. One of the most concerning trends is the rise of antibiotic-resistant strains of gonorrhea, sometimes called super gonorrhea. This resistant form doesn't respond to standard treatments, making infections harder to cure and increasing the risk of complications like infertility and increased HIV transmission. The consequences of untreated STIs go far beyond individual health. Economically, the CDC estimates that STIs cost the US healthcare system over $16 billion annually in medical costs. That includes diagnosis, treatment, and managing long-term complications like pelvic inflammatory disease, ectopic pregnancies, and even certain cancers linked to HPV. Another critical point is that many infections are underreported. Because so many cases are asymptomatic or people avoid getting tested due to stigma or lack of access, the actual numbers might be even higher than official data suggests. This epidemic also affects other public health efforts. For example, STIs increase susceptibility to HIV infection, making prevention and control efforts more complex. It's clear that we're facing a growing public health crisis, yet funding for sexual health clinics and public awareness campaigns has been inconsistent or cut in many regions. Without proper investment, testing, education, and treatment access, the problem is only going to get worse. So when we talk about we have STIs and STDs problem, we're not exaggerating. This is a critical issue that impacts millions, yet it often remains hidden or ignored because of stigma, embarrassment, or misinformation. Coming up next, we'll dive into how STIs actually affect the body, the symptoms, complications, and why early detection is so important. All right, now let's get real about something that's really holding us back in this STI epidemic. Stigma. The shame, judgment, and silence that surround sexually transmitted infections are massive barriers to prevention, testing, and treatment. When someone hears the words STD or STI, what comes to mind? Many people, there's an immediate association with dirty, promiscuous, or irresponsible. This stigma is not only unfair but dangerous because it discourages people from talking openly, seeking testing, or getting treatment. Studies have shown that people often avoid or delay getting tested because they fear judgment from healthcare providers, family, or partners. They might worry about being labeled or losing relationships. This fear and shame often keep infections hidden and untreated. This silence perpetuates the spread. If people don't know their status, they can unknowingly infect others. And since many STIs are asymptomatic without regular screening, infections fly under the radar. Misinformation is another huge problem. There's so much false or incomplete information about STIs floating around online, in communities, and even sometimes from healthcare providers. For example, many people believe that if they don't have symptoms, they can't have an STI. That's flat out wrong. You can be completely symptom-free and still carry and transmit an infection. That's why regular testing is essential. Another common myth is that only promiscuous people get STIs. This is not true. Anyone who's sexually active can get an STI, regardless of the number of partners or sexual practices. Sex education often fails to convey this, which leads to stigma and shame instead of informed prevention. Then there's confusion about how STIs are transmitted. Some people believe you can get an STI from casual contact like hugging or sharing utensils, which isn't the case. This kind of misinformation fuels unnecessary fear and discrimination. Access to accurate information varies wildly. In many schools, comprehensive sex education is still lacking, leaving young people uninformed or misinformed just when they need knowledge the most. There's also the issue of language. Medical jargon can be confusing and intimidating, making people less likely to ask questions or understand their options. Clear, accessible information is critical. The media also plays a role. When STIs are portrayed, it's often sensationalized or stigmatized, reinforcing harmful stereotypes instead of promoting understanding and compassion. What we need is a shift in how society talks about STIs, moving from judgment and fear to education, empathy, and empowerment. Imagine a world where getting tested is normalized, where conversations about sexual health are open and honest, and where people feel supported, not shamed. That's how we can reduce transmission and improve outcomes. It starts with breaking the silence, talking openly with partners, encouraging routine screenings, and educating ourselves and others. If you're listening right now and feeling embarrassed or scared, know this: you're not alone, and there's no shame in seeking care. Protecting your health is a form of self-respect, not something to hide. In the next segment, we'll dive into prevention strategies, what really works to stop the spread of STIs and protect yourself and your partners. Let's shift gears and talk about what actually works when it comes to preventing STIs. Prevention is the cornerstone of controlling this epidemic, and the good news is there are proven, practical strategies that anyone can adopt. First up, condoms. They're often called the gold standard of STI prevention, and for good reason. When used correctly and consistently, latex condoms can reduce the risk of most STIs by up to 98%. That's huge. But here's the thing: condoms only work if people actually use them. And consistent use is where many fall short, often due to lack of education, access, or social pressures. That's why comprehensive sexual education is critical. People need to understand not just how to use condoms properly, but why it matters. This means starting from a young age with age-appropriate education that covers anatomy, consent, contraception, and STI prevention, not just abstinence. Beyond condoms, there are other prevention tools that are becoming more important. For example, pre-exposure prophylaxis, or PrEP, is a medication that can drastically reduce the risk of HIV infection. While PrEP doesn't protect against other STIs, it's a powerful tool in the overall prevention toolkit. Then there's regular testing. The CDC recommends that sexually active people, especially those with multiple partners or in high-risk groups, get tested for STIs at least once a year. Some should test more frequently. Testing is crucial because many STIs don't show symptoms. Early detection means early treatment and reduces the chance of spreading infections to others. Let's also talk about vaccines. Yes, the HPV vaccine, for instance, protects against the human papillomavirus, which causes genital warts and cervical cancer. It's recommended for both boys and girls, starting around age 11 or 12, and can be given up to age 26. Or even older in some cases. Similarly, there's a vaccine for hepatitis B, which is also sexually transmitted and can cause serious liver disease. Another prevention strategy is open communication with your sexual partners. This might sound simple, but it's often overlooked. Talking about sexual history, testing status, and boundaries can reduce risk and build trust. And don't forget about limiting the number of sexual partners or practicing mutual monogamy. Being in a committed relationship where both partners are tested and free of infections. It's also worth mentioning that certain behaviors like alcohol or drug use can impair judgment and lead to riskier sexual activity. Being mindful of these factors is part of taking care of your sexual health. For people who experience stigma or shame around buying or carrying condoms, some communities have started condom distribution programs and free testing clinics to increase access without embarrassment or cost barriers. Technology is also playing a role. There are now apps that remind people to get tested, order home testing kits, or find sexual health resources near them. In short, prevention is multifaceted. It's not just about one thing, but a combination of strategies that fit individual lifestyles and needs. And remember, prevention doesn't have to be boring or awkward. It's about empowerment and taking control of your health. In our next segment, we'll discuss the treatments available for STIs, what happens if you do get infected, and how modern medicine can help you recover and stay healthy. So you've done the testing and maybe you've gotten some news you have an STI. What now? Let's talk about treatment and living with STIs, because this is where a lot of myths and fears take over, and it doesn't have to be that way. First things first, not all STIs are the same. Some are curable, others are manageable, but even those that aren't curable can often be controlled with proper treatment. For example, bacterial infections like chlamydia, gonorrhea, and syphilis can typically be cured with a course of antibiotics. It's critical to complete the full course of medication, even if symptoms disappear early, to make sure the infection is fully cleared. On the other hand, viral infections like HIV, herpes simplex virus, HSV, and human papillomavirus, HPV, don't have cures yet, but they can be managed effectively. Antiviral medications for herpes, for example, can reduce outbreaks and lower the chance of transmission. People living with HIV today can live long, healthy lives thanks to antiretroviral therapy. These medications suppress the virus to undetectable levels, which means the virus can't be transmitted sexually, a concept called U=U, or undetectable equals untransmittable. Now, it's essential to notify your sexual partners if you've been diagnosed with an STI. This can feel scary or uncomfortable, but it's a critical step for public health and for protecting those you care about. Many places offer confidential partner notification services to help with this process. Living with an STI can carry emotional and psychological weight too. Feelings of guilt, shame, or anxiety are common, but remember, having an STI is not a moral failing. It's a medical condition that deserves care, support, and understanding. Finding a supportive healthcare provider who respects your privacy and treats you without judgment is key. Don't hesitate to ask questions and get the information you need about managing your condition. Regular follow-ups and monitoring are important, especially for viral STIs, to adjust treatment as needed and monitor health. Another important point, safe sexual practices don't end with a diagnosis. Using condoms and other barriers, taking medications as prescribed, and staying informed about your sexual health help reduce the risk of transmitting infections. It's also vital to maintain open communication with your partners and healthcare providers. Many people find support groups or counselling helpful. Connecting with others who understand what you're going through can reduce isolation and build resilience. Living with an STI doesn't mean your life stops or your relationships have to suffer. With the right treatment, knowledge, and support, you can continue to have a full, healthy sex life. Finally, remember that prevention and education don't stop here. The cycle continues with regular testing, honest conversations, and staying proactive about your health. Next, we'll discuss the broader impact of STIs on society and what can be done at a community and policy level to better tackle this ongoing epidemic. All right, folks, we've covered a lot today, from understanding what STIs and STDs are, the numbers behind the epidemic, the role stigma plays, prevention strategies, and even treatment and living with these infections. So where do we go from here? What's next in the fight against STIs? The truth is, this isn't just an individual problem, it's a public health challenge that requires all of us to step up. First, education remains the foundation. We need better, more comprehensive sexual education programs that start early and keep pace with the realities young people face today. No more shying away from frank, honest discussions about consent, contraception, and sexual health. Second, accessibility must improve. Testing and treatment services need to be affordable, convenient, and stigma-free. Free or low-cost clinics, at-home testing kits, mobile health units, these are some ways to make care reachable to those who need it most. And while we're at it, normalize conversations about sexual health in everyday life. When we treat it like any other health topic, like diabetes or heart health, the stigma shrinks. On the policy side, governments and health organizations have to prioritize funding for sexual health services and research. This includes expanding vaccination programs, developing better treatments, and improving data collection to understand who's most affected and how. Communities also play a huge role, supporting one another, especially marginalized groups who often bear the brunt of this epidemic, is crucial. Peer-led initiatives, culturally competent outreach, and inclusive messaging make a difference. And let's not forget technology's role. Telehealth has revolutionized access to care for many. Digital platforms can provide education, counseling, and even prescription services discreetly and efficiently. For individuals, what can you do? Stay informed, get tested regularly, talk openly with partners and healthcare providers, use protection, advocate for better sexual health resources in your community. Ultimately, addressing STIs is about respect for your body, your partners, and your community. It's about breaking down shame and building up knowledge and care. It's a big task, but it's doable, and the benefits ripple far beyond just sexual health. When we get this right, we see stronger relationships, healthier communities, and a future where sexual health is just part of overall well-being. Thanks so much for tuning in to this important conversation. If you found this episode helpful, please share it with your friends and family. You never know who might need to hear this. Remember, knowledge is power, and together we can turn the tide on this epidemic. Stay safe, stay informed, and until next time, this is Alexandra signing off.